According to Dmitry Broshkov, CEO of Zenbit Tech, quality assurance in healthcare involves continuous monitoring, assessment, and improvement of health processes to minimize errors, and also to prevent adverse events and optimize patient outcomes. Quality assurance aims to enhance patient satisfaction, to increase healthcare efficiency, and to promote evidence-based healthcare practices. Quality assurance benefits everybody who is involved in the business of healthcare, from healthcare workers who have to ensure that their work meets high and internationally accepted standards. Business owners who package and sell healthcare as a commodity must also ensure that their product is of a high quality standard. Regulatory authorities such as Department of Health must also enforce compliance and legislations to ensure that the healthcare that is offered in the country or at any healthcare facility is of a high quality standard. And finally, the patients and workers who consume the healthcare offering that we package for them benefit the most from knowing that they entrust their lives to us with an expectation that the quality they are receiving is great. But the question remains, what constitutes a high quality occupational health in the workplace, and how do we achieve it? Colleagues, good evening, and I welcome you to our first of the 3 ethics webinar sessions of 2024. My name is David Mkwanazi. I'm a master's candidate in health professions education from the University of the Free State. Professionally, I'm an occupational medical practitioner, travel medical practitioner, ergonomic risk assessor, and exposure scientist. I have a deep passion for training the occupational health professionals to become the best thing to ever happen to the South African workers. Let's just go through some house rules first. This session is accredited for 1 ethics CPD point by Health Professions Council of South Africa. Kindly please drop your HPCSA number, full names, and email address in the chat box to register for CPDs. For those who are not registered with HPCSA, an attendance certificate will be issued. Please keep yourself muted at all times, preferably also your video. Please turn off your video also to avoid interrupting the presenters. This session's attendance will be monitored for the entire duration of 1 hour. Kindly please ensure that you do not join using nicknames or aliases in order to be properly identified. Each session will be podcasted on YouTube for long-term education and training purposes. We have realized that a lot of colleagues go back to our YouTube page to recap on the information that may have been missed during our sessions. In the future, we will also add a Q&A videos for questions missed. For questions missed during our sessions, we thank you for your continued support in this regard. The link and CPD questionnaire can be accessed on www.ohesa.co.za under webinars. For those who wish to earn CPD points after watching the podcast, 70% mark is required to obtain these CPD points. Participants will be allowed to ask questions or comment after each session. Questions can be posted in the chat box anytime during or after the presentation. Owing to the popularity of our podcasted YouTube webinars, we also urge you to post all your questions there in order to benefit a wider audience of colleagues and to ensure that information becomes readily available whenever we need it. Colleagues, as you know, this is always a multidisciplinary session. Some of the things that are being explained might not be applicable to you or might not make sense to you, but be sure to know that there is somebody else who is enjoying the content, whom it might be appropriate to. Please sit back and relax. The webinar is about to start. In today's session, we look at some of the elements that form part of quality assurance in occupational health. We will introduce you to the healthcare core standards and compliance processes, then outline the process of occupational health facility audits, and finally introduce you to the concept of equipment calibrations as a quality assurance mechanism. Please note, colleagues, because of the technical nature of calibration processes, we will host an in-depth session on calibrations in the new year, 2025 that is, but for now, we'll just touch up on the basics. Today's session is proudly brought to you by Corporate and Industrial Medical Consultants and Occupational Health and Exposure Sciences Academy. Occupational Health Exposure and Exposure Sciences Academy was founded with the sole purpose of bridging the gaps between different occupational health professional fields and making sure that we all speak the same language and approach workplace problems comprehensively and collaboratively. Obviously, for the safety of our workers and patients, empowerment of ourselves, and productivity of our workplaces. Colleagues, we also acknowledge and show gratitude to our panelists for sharing their knowledge with us this evening. Over the past few months and following the success of our different webinar sessions, we are proud to introduce our very first face-to-face course that will be held at our studio in Vereeniging on the 28th to 30th of November 2024. This will be a practical occupational health risk assessment course covered over 2 days, during which we will learn the theoretical aspects of workplace risk assessments and also to get to visit a workplace to conduct a risk assessment as a group. The objective is to empower occupational health professionals who need a practical exposure to identifying hazards, quantifying risk, and clearly communicating their findings to enforce the culture of health and safety in the workplace. This course will be accredited for a total of 10 general CPD points plus 2 ethics points by the HPCSA. Details and registration link can be obtained from ohesa.dlp@gmail.com or on WhatsApp 064 520 3301. Thank you very much. Colleagues, in our first session of the evening, please allow me to introduce Miss or Sister Jackie Stewart. She is the Chief Executive Officer of COSASA based in Cape Town. Having qualified as a nurse, she specialized in cardiothoracic nursing. She has worked in the public and private health sectors in South Africa and England. She has a Master's of Professional Studies, specifically in health from Middlesex University in London. She was a member of South African National Lancet Commission on High Quality Health Systems. And in 2019, she was elected to the ISQA Academy of Quality and Safety in Healthcare, also known as IAQS. She is an ISQA expert and serves on the Accreditation Council of the ISQA External Evaluation Association. She served on the ISQA board from 2017 to 2020.
Good evening. I'm Jackie Stewart, the Chief Executive of COSASA based in Cape Town, and it's a pleasure to be with you this evening. I want to talk to you about our accreditation program, how to achieve compliance with standards, and more importantly, how to make that a sustainable process. We are a non-profit organization, as I say, based in Cape Town. We've got almost 30 years experience. Our 30th birthday is next year. and we've been working across Africa doing quality improvement and accreditation. I'm very proud to say that the International Society for Quality in Healthcare External Evaluation Association has accredited COSASA 6 times since 2002, and our current award for our organization, our standards, and our surveyor training program was conferred in 2023 and is valid until 2027. Currently, we are the only SQA internationally accredited healthcare facility accreditation body in sub-Saharan Africa. Why are we here? I really believe our purpose is to create a safe healthcare journey for every patient in Africa. We may not do that alone. We certainly believe in working in collaboration with others, but that is what our goal is, to ensure that everybody gets good healthcare. We inspire quality healthcare, basically one institution at a time. And I have a great example of that. We recently accredited a hospital in Uganda, and other hospitals around had talked about coming into the program, maybe not. As soon as they saw that Vaga was accredited, they were like, yes, please, now. And so immediately we signed up 2 more. So that does, I think, inspire other people to join. We're world-class accreditors, up there with the best, and we have our expertise is in Africa. I believe that quality and safety are the absolute cornerstones of effective healthcare. And the importance for me is not only should people get effective healthcare, but they should get compassionate healthcare. That it must be safe and it should be respectful. And I really passionately believe that, and that is what we strive for every time, every day when we get out there with our clients. And we do that through empowering the providers by giving them knowledge, giving them the tools, giving them support to deliver the care. And it's about building capacity that will be sustained. Don't just train and go, but ensure that people understand not only what they're doing, but why they're doing it. And that way we believe then that the healthcare workers become more inspired to affect the patient journey, and that they can contribute to the whole movement for better healthcare. Let me talk a little bit about our standards, because they basically underpin what we do. They are developed in accordance with the principles of ISQA, and those principles relate to the fact that they cover the whole facility. They are patient-centered. More recently, they've introduced principles relating to sustainability and the environment. We have to acknowledge that healthcare is a major contributor to health, to climate change. So those principles are built into the standards so that across the globe, wherever people are accrediting, we're all doing it to the similar principle. As I said, our standards are accredited by ISQA, and the standards provide a blueprint for good practice. They really tell you, if you put everything in place that is in the standards, there should be no surprises for anybody who is a trained healthcare professional in whatever discipline. There's no rocket science in it. It's the basics, but it's scientific in as much as it's all been tried and tested. But that is, if you put those standards in place and comply with those standards, you will be doing the right thing. This is an example of our standards. I just picked one with a short presentation, just one to give you an example. So you have a standard which says occupational health functions of occupational health practitioners are provided in accordance with country-specific legislation, documented processes, recommendations of professional organizations, etc. And then underneath that, we have 3 or 4, maybe 5 criteria that unpack that standard. So the first one talks almost to the words of the standard, that this is how you provide it. And we want to see that legislation. We want to see that you know what you're doing and how you're doing it. We use the generic terminology because we work across different countries. We cannot refer to each country's legislation specifically, or we'd have multiple standards. And And the second criterion is that the staff have ready access to all of the reference material and recommendations that are there, and that they can find the legislation easily and accessible. It's not hidden on the top shelf or in some file that nobody knows where it lives. And that's the structure of all our standards, that they have the criteria being the measurable element. The criteria are weighted depending on the impact that they have on either patient care or legality or safety. And the scoring is done as either non-compliant, partially compliant, or compliant, or it may be not applicable. And that means it's not relevant in that service. It doesn't mean it just isn't there today, not applicable at all. So if a standard is non-compliant and it's very serious, it will score 5. If it's partially compliant and moderately weighted, it will score 65. So immediately you easily see that the difference in numbers shows you where you need to put your attention. We believe the partially compliant score is very important because it encourages the staff not only to strive for compliance, but also for a culture of improvement. Because if you go from non-compliant to compliant, how do you know what's in between? And a lot of regulators, including the Office of Health Standard Compliance, have a sort of yes-no binary system. But we believe the partially compliant is important, that you can see the progress you're making. You may stay partially compliant for some time, but you're moving towards where you need to be and thinking about how you improve. This graphic is really just shows you the structure of the scoring. So the criteria scores are aggregated to give you a standard score. The standard score aggregated to give you the performance indicator score, which is like the key functions within a service. So your management, your facilities, your equipment, your staffing. And then the service element, in your service, occupational health, obviously that would be a service in itself. But for example, in surgery, you may have orthopedics, general surgery, vascular surgery. Those would all be surgery in one service element. And then the aggregation of those gives you the overall facility score. But this graphic is actually quite helpful as well for giving people the sense of teamwork, because if I don't deal with my criteria, then I'm going to bring down the overall facility score. So it's about, showing that everybody contributes to the whole. Our accreditation processes are rigorous, and I make no apology for that at all. If accreditation was easy, everybody would have it, and we wouldn't be where we are today. We would have fabulous systems everywhere, wouldn't we? But it's something that you have to aspire to, and you have to work towards it. And it's about elevating the standards of healthcare facilities. The external evaluation is carried out by experienced healthcare professionals who use a kind of peer review approach. And I think this strongly reinforces the fact that this is not a one-off event, but it's a continuous journey towards excellence. And I use the analogy that it's not a sprint, it's a marathon. And that for me is really important. We support the program with our 24-hour digital platform, which we provide to all the clients in the program, and that they can capture their compliance data, the standard compliance scores, and they can also capture their quality improvement activities and what they are doing. So compliance and improvement must go hand in hand. It's not just about ticking the box to comply, but genuinely saying that we want to sustain this improvement and keep it going over time. As with anything in quality, it's a cycle. And I think anything in health, it's a cycle, isn't it? We diagnose, we treat, we review. So we introduce the standards, we train people on the evaluation methods and some quality improvement. We get them to do a self-evaluation, using that to embed the learning. We recommend that we carry out a baseline evaluation to give people an objective opinion about where they are against the standards. And then we provide feedback on that about where maybe their priorities are, maybe where they want to start, where they should concentrate. We train them to use CoQuest to capture the data and to import their quality programs. And we teach them about quality improvement methods. And then they continue with the self-evaluation process, capturing data of standard compliance on a regular basis, and also about their improvements and what they're doing to support that standard compliance. What evidence do you have that shows me that you know that standard is compliant, because you've put in place the systems to make it sustainable? When you are close to, you think, fully compliant with the standards, we then carry out an external evaluation with an independent team, different from anybody else, that's helped you along the way with a view to accreditation. And that's when I tell the clients that the good news is you're accredited, well done. The bad news is this is where it really starts, because sustaining that accreditation and maintaining the standards is when you really know that you've got it. And when you've been reaccredited 2 or 3, 4 times, then you've really got it in your DNA and you're doing what you should do all the time. So just in summary, what CASASA does, we do accreditation supported by our information system CoQuest. We do training, and as I say, we focus on building capacity that's sustainable. And we also have advisory services around quality improvement, around standards. We've also helped ministries to implement their own or develop their own accreditation programs. So those are the things that we do. I love doing it, and I hope that you are inspired to do it yourself in your own services. You can get in touch with us either via the website or our queries email address. And I'd be happy to take any. I can't take questions tonight, but if you'd want to contact me with any queries, very happy to take that. So thank you very much for your time.
Colleagues, thank you very much to Sister Jackie Stewart. As I've mentioned, Sister Jackie Stewart is a Chief Executive Officer of COSASA. Unfortunately, she could not be with us tonight as she is traveling overseas for a conference, but she was more than kind enough to share her knowledge with us, and she has promised that next time we invite her, she'll be more than happy to guide us through this process of accreditation and assessments and quality assurance. I'm sure some of you will remember COSASA as the institution that used to come to the hospitals to do audits, and then we would work around the clock like mad people the day before, get everything together, buy syringes, buy needles. It is that COSASA. And I'm here to remind you that COSASA exists for all health facilities in the country, including the occupational health ones. By law, or according to law, occupational health clinic are health facilities also. We should all be registered with the Department of Health as health facilities, and we should also undergo these rigorous processes of accreditation and assessments to make sure that we meet the required standards. On that note, colleagues, I would like to invite you to ask your questions in the chat room. However, Sister Stewart will not be here to answer them, but will more than happily so share them with her and see if we can answer them on our YouTube video or YouTube page. Please allow me to welcome our next speaker, Sister Megan Abels. She's an occupational health nursing practitioner who is also a member of SASHON in Gauteng. She completed her BK nursing degree in 2008 at the University of Johannesburg, and also continued her studies in 2021 with FNHD in occupational health nursing, also at the University of Johannesburg. She's a dedicated nursing professional with a rich background spanning 16 years in various specialties. She earned her Bachelor of Nursing Science in 2008, as I have indicated, and further enhanced her qualifications with National Higher Diploma in Occupational Health in 2021. Currently, she is in her final phase of Masters in Nursing Science with a submission date set for November 2024. Good luck, sister. Megan's diverse nursing experience includes roles in theater, labor and delivery, postnatal care, and as an HIV case manager. She discovered her passion for occupational health in 2013, which has since shaped her career. Presently, she serves as an occupational health nursing practitioner at the University of Johannesburg's Doornfontein campus. In addition to her clinical work, she is actively involved in the Sashon Regional Executive Committee in Gauteng, where she represents Central Gauteng as educational representative. With a commitment to advancing nursing practice and health education, Megan continues to make significant contributions to the field and inspires others in her profession. Sister Megan is here to talk to us about clinic or facility audits, as we often encounter them from Sashon. Sister Megan, are you there? Hello, sister.
Hi, Doc. Sorry about that. I was talking to myself.
Okay. I think you can talk to us now.
Thank you. And may I share my screen?
Yes, I'm about to stop sharing. Are you well today?
I'm well, Doc. Thank you so much for having me and welcome to everyone. So I'm going to jump right in. Can you see my screen?
Yes, sister, please go ahead.
Perfect. Firstly, thank you, Doc, for the invite. I'm very honored to be here to discuss quality assurance in occupational health from the perspective of an audit tool. I'm not too sure how many of our, oopsie, sorry, I'm getting ahead of myself here. All right. I'm not too sure how many of our audience are occupational health nurses, but I think auditing in general is a fantastic way to obviously elevate our healthcare facilities and the service provided to our community that we take care of as occupational health nurses. So my objective for this evening is, number one, getting the audit dread out of everybody's head. And number two, we got to try and stay ready so we don't have to get ready. And you reminded me, Doc, of the CASASA audits in the hospital where everyone would look for files and then do emergency trolley checks. And that in itself is such a traumatic exercise. And I think perhaps because we all went through some sort of rigorous last-minute panic mode audit, we've got some sort of a trauma bond attached to that. And I'm here to tell everybody that it does not need to be traumatic at all. You might think that I'm a little bit off my head when I tell you that audits are actually fun. Okay, so those are our two objectives. And I'm going to show you how you can get that dread out of your head and how you can stay ready so you don't have to get ready. So a little bit of a history lesson when it comes to auditing. Auditing is not a new thing at all. It's been around since the 5th and 4th centuries BC, where the Romans and Greeks had to develop meticulous systems of checks and balances to verify the accuracy of their reports. So much like the audits that we undergo within our healthcare practice environments, we are just doing a meticulous check to see that we are in line with the service that we are delivering, to see that we are in line with the policies, the procedures, the acts, the guidelines that are set out for us as well. So our Roman and Greek cousins or brothers have been doing this long before we were even in our healthcare professions today. So everyone knows what the purpose of an audit is. The purpose of an audit is not to give us a heart attack. It's not to send us to ICU. The purpose of an audit is just a checklist. And it's to assess the quality of the service that is rendered by the occupational health clinic or whichever health practice you find yourself in. The purpose of the audit is to also identify areas where our service can be improved upon. So it's not to say, well, you failed the audit, therefore you're fired. It's there to say, there are a few gaps within the service that you deliver. So let's fix those gaps to ensure that we are providing a better service to our communities. And let's also fix those gaps to ensure that we are in keeping with the acts and omissions that we prescribe to as part of SANC, or as part of our whichever healthcare profession you belong to. So it's just a checklist. We do checklists every day in our daily lives. And this is just a way in which to formalize a checklist within the practice that we're working. So everyone, I hope that you are taking nice deep breaths in and out, and you're feeling a little bit more relaxed about the word audit. Okay, so I have undergone a SASHON audit twice. The first audit, which was conducted at the clinic at Doornfontein campus with the University of Johannesburg, was conducted last year. Any score according to SASHON, which is above 80%, is considered a practice that is running relatively well. And my manager, I think Sister Miranda is actually in this meeting, can attest to when I said, Sister, we got 82%, she said, well, let's see if we can actually get to 100%. And so we worked tirelessly and put our names up again for a second audit this year, achieving a score of 96%. And so because we are hungry, because we are a higher education institution and we're hungry for marks, we are now working on that last 4%. I'm just going to quickly show you what our SASHON audit tool looks like. Oh no. Let me just hop on, let's just change. Don't seem to be getting there. All right, I'm not too sure if there are any occupational health nurses that are aware of our SASHON audit tool and how it looks, but it is a very comprehensive tool. Oh, there we go. I wonder if everyone can see this one. Doc, can you see it?
Yes,
okay.
we can see it.
Perfect. So it is a very comprehensive tool that the auditors utilize in order to identify where your practice is in terms of the service that we deliver to our communities. I'm not going to run through every single line item, but as you can see, the basis of the audit is divided into our policies, managing our skills on site, our occupational health and safety, risk assessments, waste management, PPE, first aid, policies and procedures. So it is a very comprehensive tool. The audit takes about 8 hours, and it is a lot of discussions around what your role is within the industry and how are you keeping the how are you keeping to the policies and the procedures that have been set out within your practice. So I'm just going to hop back onto my slideshow. Oh, that's not my slideshow. Apologies, everybody. Just navigating with two screens here. All right. So as you can see, it is, like I said, a very comprehensive tool. It is a very time-consuming procedure, but it is a very, it's actually a wonderful tool to assess where your practice is at. So as I showed you within the tool, it covers 5 big sections that you and the auditors go through, namely our governance and administration, which is all our acts that we implement within our practice. So that's everything from the Occupational Health and Safety Act, the Nursing Act, Employment Equity Act, Basic Conditions of Employment Act, Medicines and Related Substances Act. It looks at our clinical services. So within our occupational health setup, what services are we rendering to our community? Are we doing our audios? Are we doing spiros, vision testing? Are we as practitioners up to date in terms of our training? Are we as practitioners following the most recent updates, the guidelines set out by law in order to provide a high quality service? So it's no use us conducting audiometry screening, but the last time we did audiometry was perhaps in 1994, because things have changed since then. So it's always good to keep up to date with current trends, current policies, current procedures, and current ways of practice. Health promotion and education. We are a practice that is preventative in nature. So the auditors want to see evidence that we are promoting health within our industry and we are providing relevant education. Our workplace environment, which refers to everything regarding the safe working environment for our employees. And that comes down to health risk assessments, it's waste management, it's occupational safety. And then at the center of it all is what is our role as the occupational health nurse within industry? And can we provide evidence to substantiate that role? For example, part of our role is promoting health and education. What evidence can you provide to the auditors? Perhaps you've done a health talk recently because you've noticed there's certain staff in an area that are now exposed to noise, and you've noticed now an elevation in their percentage loss of hearing. So you go ahead and you go and educate them on how to utilize their PPE. So everything that is highlighted, all these key areas in our audit tools require evidence. So it is no use saying, yes, absolutely, I do health education. Yes, absolutely, I promote health. Where is it written? And obviously, being in the nursing field, we'll all remember our matron saying, if it is not written, it is not done. And the same applies with the audit. If you cannot give evidence to substantiate your activities within your industry, then it obviously is as if you have never done it, which is sad because we all work quite hard within our industries. Okay, so 2 objectives we had in the beginning, and that was getting the audit dread out of your head. There is no magic wand that you can wave to get this out of your head. There are 3 steps. Number 1, you've got to first at least look at the audit tool. So it is available on our Sashon website, and it is a free download. And I hope that there are some occupational health nurses here that have seen exactly where on the Sashon website you can find it. So the first thing I expect you to do is at least look at it, at least find it on the internet. The second part is read the audit tool. And then the third one is read it again. Because the first time I read this audit tool, I went into panic mode thinking, oh my goodness, is everything up to date? I don't have this, I don't have that, I don't understand what they're asking for here. But when you read it again, then you can actually picture yourself in the practice where you're operating from, and all those pieces of the puzzles fall into place. So getting it out of your head, getting the dread out of your head, is first looking at that audit tool and then reading through it. The second one is stay ready so you don't have to get ready. And this is a fantastic way in which to measure your practice's quality, and that is through internal audits, which we conducted at our UJ occupational health practices. And it is one of the points that you can earn on the Sashon audit tool. So your colleagues, your peers can audit your clinics and help you to identify where there are sections that you can improve upon. So you can conduct these internal audits as many times as you like during the year until you achieve that 100%. And it doesn't cost you anything. It just costs you a bit of time, which I feel is time well spent. So if you're doing regular internal audits, even if you're doing them on your own, it's definitely time well spent. So quick closing in summary, the benefits of an audit, and I've said it throughout this presentation, is to improve the quality of service that we provide to our community. It's to ensure that we are compliant with relevant policies, with relevant legislation, with relevant procedures. It enhances our employee engagement. So if employees understand that they're coming to a clinic that's of a high level provides a high level of service, they're going to want to come back constantly. It also helps us to understand our roles as occupational healthcare professionals, practitioners within the industry that we operate from. And then once again, it ensures a high standard of service that is delivered to our communities. What is our main goal as occupational healthcare practitioners is to obviously prevent injury, to prevent illnesses or diseases that are related to workplace exposures. And what better way of doing that by ensuring that we've got a high level of service that we are providing to our staff. So that is me, Doc. I think I went 1 minute over time. I'm not too sure if we have time for a bit of a Q&A.
And don't worry, sister, we're not counting.
Okay.
Sister, I have a question. You said it's a fantastic, and most of the colleagues would never put the word fantastic and audits in the same sentence.
Yes.
For reasons known to you and myself. How can we make it feel easy and fantastic, like you are saying? How can we realize that this is not something that's there to judge us, but to help us become better occupational health institutions, for instance?
Well, Doc, I mean, that's a great question. And like I said in the beginning, we're all faced with this dread of having an audit because we just know what the pressures are like when it comes to audit time. It's sleepless nights, it's too much caffeine, it's everyone dreaming about those files spread out on the boardroom table. But if we look at the main core purpose of our audits, is to improve us, number one, as practitioners. So when you're working from a place of, I'd like to improve myself and the service that I provide, when there is room for self-improvement, already 90% of the battle is won. So if the colleagues look at it from that perspective, that this is to improve me, my service as a practitioner. We're in an industry of service, right? We are serving communities. We are not there for our own egos. Our professions are humble ones. And therefore, if we can improve the type of service that we are delivering to our clients, it does make the audit fun. And it does give you a new perspective on how to approach your practice, how to manage your practice, and how to ensure that when your employees engage in your practice, you are giving them the best possible service you can give. Look, the first one's never fun. Doc, look, let's get this straight. The first one's never fun.
Yeah.
Let's not kid each other here. But the more you do it, the better it gets. And the more you get the hang of it, where you implement that audit tool and you see those results, man, those results are rewarding. So put the fun in the audits, make it a team building exercise.
Okay, thank you very much, sister. I see Sister Nompumelelo here commented, the purpose of the audit is not to cause heart attack. I like.
Yes.
And I have a question from Mr. Katleho Mokoena. In areas where there are no audits with respect to different areas of services, how does one create a tool to be able to at least do internal audits? Thank you for taking my question. He knew we would take the question.
That's a great question. We've got to, first you've got to identify what is your practice there for? What is the sole purpose of your practice being within that community? Is it to provide a certain amount of healthcare? So for example, if we take, and I'm just speaking now on occupational health because that is what I'm soaked in, we look at our Occupational Health and Safety Act. If we did not have a tool in place, I would take that act and then derive a very basic audit tool for the practice that I'm running. Within that act, it stipulates, number one, we need to prevent hazards from impacting our workers. How do we do that? And you can go line by line as a practitioner. How do I prevent these risks from impacting the health of my workers? Number one, health education. Number two, promoting health. Number three, identifying those hazards that could sort of manifest into a risk. And how do I do that? So if you take any piece of legislation, you can adapt it to your practice, and you can pull out pieces of legislation that apply to your practice and look at the actions that you can take in order to do, in order to ensure that those actions are met. So if legislation, I think, is your best way to go. I'm not too sure if on the SANC website there's something, but just look and see what legislation is applicable to your practice and see if whatever objectives you have are meeting the criteria of that legislation, and take it from there.
Thank you, sister. This one is from Sister Miranda Chabangu, our boss. Good presentation, Megan. Thank you.
Thank you, sister.
And just a comment on the answer you've given to Mr. Mokoena. The answer is deeply appreciated.
You're welcome, Kenna.
Yes, sister, I'm going to ask you to stay on for a few more minutes in case there are other questions. And I'm also going to ask you to stop sharing now.
Perfect.
All right, colleagues, we thank Sister Megan for that wonderful presentation, and she seems to believe audits are fantastic. I'm not sure if I agree, but yeah, let's go with that. In the last section, colleagues, I just want us to talk about calibrations. Remember, we often do calibrations, but I'm wondering how many of us knew that calibrations is actually part of this whole quality assurance process. Calibration is defined as the process of configuring an instrument to provide accurate results for a sample within an acceptable range. Also, eliminating and minimizing factors that can cause inaccurate measurements is a fundamental aspect of this instrumentation result. When calibrations are performed, there are certain specific tools that are used by technicians to calibrate. So this is a non-specific question because it applies to anything that is used, including a normal, simple syringe that we use to determine how much air or how much fluid is pumped into an instrument. That can also be a calibration equipment. But what must be calibrated, especially in our setting in occupational health? Most of us know that our audiometers are calibrated, our spirometry machines are calibrated. I would say anything or any machine that is expected to give quality results can be calibrated. And most of the times we go on and I'll remember in some of the hospitals will use like a blood pressure machine for a good 5 years because it still looks new and it's still working perfectly, only to find out after a year or two, it's no longer giving the accurate result that we expect from it. And obviously, we also have to consider the shelf life for every individual appliance or piece of equipment or instrument. So calibration is a very important thing that we have to start viewing as part of the quality control process. We know with spirometries, when you buy a new one, it will come with a calibration certificate from the laboratory performed by the original equipment manufacturer. And then we also know that before we perform spirometries in our offices or our clinics, we have that nice big syringe that we use to calibrate with. The main purpose of that, colleagues, is quality control. Apart from the fact that we are expected to do it and according to legislations and according to the law, but the whole idea is to make sure that when you give a patient the results, you are almost 100% certain that the results are a true reflection of how his body or a part of his body functions. With the colleagues that are using Kudu Wave, for instance, we have a feature that is called X-Check. Colleagues that use Kudu Waves will know, whereby you connect, the sound outlets into the internal calibrator and run the calibration to determine if it's still picking up those sounds as intended. So that's another part of calibration that can be done in our offices. So next up, who does this calibration? Most of the times, calibration will be done by a technician that will either come to your office from the equipment manufacturer, usually licensed or accredited by SANAS, South African National Accreditation Standards. Services, sorry. So they must be SANAS accredited according to the law or legislation. They will usually come to our clinics to calibrate. I can think of Amtronics, I can think of ACTS, I can think of core calibrations that normally calibrate our occupational health equipment, but I believe there are more because the ones that I know are mostly from Gauteng, and I'm sure even our colleagues in the Free State and Cape Town or KZN do get the equipment calibrated. And then whose responsibility is it to ensure that this equipment is calibrated? Colleagues, it is our responsibility to make sure that our equipment is calibrated, to make sure that it meets quality standards. So we don't only look at the date, the last date of calibration, but we also, as another way of ensuring quality, we also inspect the results that we are getting and we correlate them with the clinical picture of the patient to determine if the machine is also working correctly. As you know, there is a concept known as biological calibration also, whereby you'll take a patient that you know to have a certain type of, let's say, in the case of audiometry, the patient that whose hearing functioning you know very well, you would subject them to the same test and make sure that you get the same results that you expect. And obviously, if the results are not as you expected, you have to start troubleshooting to figure out if your equipment is still calibrated or whether the condition of the patient has changed. Calibrations, colleagues, are normally done annually in most of the settings, but again, they are done from time to time, especially in our situations where we move with our mobile clinics. We normally have to do calibrations every time we set it up anywhere, wherever we go. We set up, we make sure we do calibrations before we move and when we come back, because the moving equipment obviously is subjected to different weather conditions and physical conditions. So it cannot be expected to function in terms of certain quality standards. Where are these performed, colleagues? We have already said they are performed on the equipment, not in our minds. And again, like I said, they can be performed at our offices, or they can be performed, we can send them away. I know in cases of our Good Waves machines, we normally send them away to the calibrator and then we get them after a day or two. So they can be performed anywhere where it is safe to do so, considering the environment of the calibration and surroundings. And then, why are they performed? Two reasons, colleagues. The first reason, and I think the most important one, is for quality control. When you diagnose your patient with noise-induced hearing loss, you want to be 100% certain that he actually does have noise-induced hearing loss. But you cannot guarantee that if your equipment is not calibrated. And you also cannot use your results or your report if it clearly states that your machine was not calibrated. And that's what takes us to the second point or reason for calibration, which is legislation. We are legislated, or we are mandated to perform these calibrations in terms of certain standards. I know the South African Society of Occupational Medicine has a policy on spirometry in the workplace, which guides us on how the spirometry must be performed and under what conditions. That's also another quality control tool. And they also have another policy called audiometry in the workplace, which also states how audiometries are supposed to be performed, under what conditions. Colleagues will know of Instruction 171, which guides us how we should perform baseline audiometries. And there's a reason why we do 2 instead of 1. And they clearly define the conditions under which these audiometries must be performed. So that's another quality control tool that is enforced on us. And it's important that we start seeing this as elements of quality assurance, not just rules. And colleagues, lastly but not least, we have certain standards that we must follow. And we'll explore this in details in our next webinar. I think it's in February or March, when we'll be discussing calibrations in details. In spirometry, we have a SANS 451 of 2008 of 2008. And this is the national standard on spirometry in the workplace, or spirometry done in South Africa. And when we perform this test, they must adhere to such standard. And then in the case of audiometry, we have SANS 183. And similarly, it is also by South African Bureau of Standards. And these 2 standards are what you can buy and what you must have as a clinic owner or as a sister working in the clinic, in the workplace, whatever factory it is or whatever company it is. we also need to start seeing all these institutions as healthcare institutions with all the policies that we need to function. Colleagues, I don't know if you have any questions, but that's where I would like to end. I see we have gone over by 3 minutes. And I would like to finally, while we're still waiting for any questions that might come up, finally, we'll have another ethics talk or webinar on the 30th of October on record keeping in occupational health. Thank you, colleagues. Sister Megan?
Hello, Doc. Sorry about that.
Yes, it doesn't look like we have any questions. We are closing. Are there any last words or final words you'd like to share in closing?
Make audits fun. That's it, Doc.
Okay. Okay, I think that is noted. There is a message from Dr. Gina from Carolina in Mpumalanga. Good evening to all. Would like to thank our presenters on their excellent presentations. The importance of excellence in occupational health can assist our operations tremendously and assist with minimizing occupational diseases and accidents. I think that's just a compliment. And from Sister Temba, thank you so much. Much appreciated. From Lefakumalo, thanks very much for excellent presentations, I think. And from Samsung, colleague, please remember to give us your name because it shows as Samsung. Thank you. This was really a good session. Sister, my final words are thank you very much. Please always avail yourself whenever we need you. Before I complete what I was going to say, Dr. Lindy Mukwena, I believe from Grill in Mpumalanga, is there any cost attached to the audit or will be covered as what is happening at the government facilities?
For a session audit, there is no cost. However, you need to be a session member.
Or you should at least have a nurse that is a session member in your practice.
Correct. And
in
yeah,
Dr. Mukwena's case.
Oh, I see. Yes, correct. So if there's a session member that wants to be audited by session, they can send through a mail to myself and they are free of charge.
Okay. I think it's mostly just compliments coming. Much appreciated insight. Thank you. Thank you from Matapelo Ngwaye, from Lucky. Oh, sorry, they are moving fast. Thank you so much, presenters. Very informative session. Please share your email, Megan.
Sure,
Let's pause there and allow you to share your email, sister, if you are comfortable to do so.
Sure. I'm typing it in the chat, Doc.
All right. Yes, sister, I was going to say thank you very much. This has been very informative. And please always avail yourself in the future when we reach out to you for assistance. And
Absolutely.
colleagues, to you all, I know we are used to doing this in 2 hours, but for the next 2 months, we'll be having these 1-hour sessions covering ethics. I'm sure you'll remember throughout the year, we've been doing clinical CPD points, 2 points for 2 hours every month, but we need to make sure that we do not neglect the ethics aspect. Your final words, sister, and goodbye from me.
Thanks, Doc. Thanks for having me. All the best, colleagues. More audits for session next year, I hope.